A very good evening. Thank you so much, Dr. Rana, for your time. Really appreciate that. And to all the people who are listening to this, one thing I would like to tell you about Dr. Rana is that, he's always very passionate about improving healthcare and what more can we do to improve anywhere in any form in any part of healthcare as a system. So whenever I've had conversations with him, it's always been about what more to do, how can we make it better, and a person who's never said no to anything. So thank you so much once again for everything that you do. I don't think people need your introduction largely because you have been a figure who's really contributed a lot and you continue to do that. So with that, I have my first question for you. That's basically about, what's the most unexpected or surprising place you have ever visited for a healthcare accreditation project?
Thank you. First of all, thank you, Gaurav, for having me here today with you on this conversation. And thank you very much for your kind words. It's really always a pleasure to have a conversation with you. I think something comes to my mind is just at the beginning of COVID-19 pandemic. And I was sitting in my office in Noida, and I was expecting a visitor, a friend, and then I got Dr. Somil Nagpal. He is actually the lead healthcare specialist with World Bank,
Right.
and we were having some conversation how to improve quality in healthcare in different part of the world. And he is currently, and at that time also was looking after a couple of regions, including Indonesia. And then he say the government of Indonesia health ministry is working. They have a standard for primary healthcare, and they want to have more structure into it. How you can help? I said, whatever I know, I can contribute to that. And says, okay, fine, thanks. And then immediately said, can you come in 3 days? I said, what are you talking about? 3 days. I say, yes, we have something to do, and we want you to be there to help and support. So it was most surprising thing actually at that point of time, getting to contribute to a country for healthcare quality improvement in just 3 days, ago, to not thinking about it, but now there is a plan in place, for example. And we were literally hearing about COVID-19, but not that much. So I traveled to Indonesia, to Jakarta, and then in 3 days, it was just two days short visit. And while I was returning, it was just like a COVID-19, all over the places and including airports, screening also. I think I can remember that's one of the surprising things comes to me in healthcare quality project.
Really interesting. Thank you so much for sharing that experience with us. My another question would be, if you would get a chance to have dinner with any historical figure in healthcare, who would that person be and why?
That's very typical question and very difficult to answer. If you talk about historical, I'll go back to, I think, to history basically. So I would like to have not with one person but the two person, because there's a combo of Dr. Crick and Watson,
Okay.
who actually unfolded the DNA structure, molecular structure of DNA, and which really helped the human being so far till then now in attending to several diseases and several phenomena of the biological systems of human being, and even gone beyond human beings anywhere with the life organism exists. So I think I would prefer to have dinner, but now because they are no longer here, if you give me another chance to have a dinner, I would like to have dinner with Dr. Pratap Reddy.
Wow.
And for simple reason, I had a couple of meetings with him, but just passing by, saying hello, namaste, but not a chance to sit with him, have a dinner or lunch. So I would love to have dinner with the Dr. Reddy, and he has been pioneer in bringing modern healthcare into India, making it a corporate world. And now you know what's going on. Rest is the history. I need not to tell about Dr. Reddy's contribution to not only to Indian healthcare ecosystem but global healthcare ecosystem.
Great. Thank you for sharing that. So, Dr. Rana, now, let's talk about accreditation and quality and patient safety a bit. So, the role of accreditation has evolved largely in enhancing patient safety and healthcare quality globally. How do you see this evolution as, how do you perceive what's happening and, at a worldwide.
Thank you, Gaurav, for this question. My journey in quality started basically in 1999, formal journey in quality. And in healthcare quality, yes, in 2000, when I joined NABL and was started looking after a medical laboratory accreditation program. Not though that much big which is today, but at that time it was just beginning of the era for medical laboratories quality and accreditation system, particularly in India. And so over that period of time, for last almost 25 years, things have drastically changed. And we have seen in last almost 20 years that healthcare quality and accreditation system has matured enough in India as well as globally. So when we talk about accreditation, which is to me is a strong tool for management to set many things right, to set many things evolve over a period of time. Also, as a support system for management to know what's going on in their organization as far as patient care is concerned, as far as patient safety is concerned. And through that channel, I would say all other things are also come into picture. It's not just when we talk about patient, it's not just patient, one person or a doctor, a nurse. It takes care of everything in the organization, whether your physical infrastructure or your medical equipment or any facility which you provide to patient in terms of clinical or non-clinical services. So it encompasses everything. So over last several years in India, it has really evolved very much, and so globally. Because it's like, when people travel across the countries, they share, they learn from each other, and they share the knowledge they have. And that's what exactly happened in healthcare quality and accreditation. In my experience for last 20 years, traveling to many part of the world, receiving many people from globe to India, and that it has like become a sort of a tradition that you can't run a healthcare facility if you don't involve quality people, if you don't implement a set of
Yeah.
standards. It's important to have a set of standards rather than, I would say, accreditation. I'm sure that you have a lot of experience with your own group of hospitals across the country and even outside country, that how accreditation is taken. There are different perspectives, and I think if we can start discussing, we can go on and on. So precisely what I say, how it has evolved is with a positive mind, where healthcare leaders started thinking that accreditation can help in improving quality of care to their patients, can help their organizations to do better. So I think it's a positive thing which has happened in this field, and I'm sure that it will be continuing over a period of time. Thank you.
I guess I completely agree with you. The rate at which the awareness has improved, not only among the hospitals or the healthcare providers, but to a larger extent, even with patients and their families in the country. I think that's a very positive step. And largely it has happened because of the accreditation systems that we have in India. So since we are talking about, some of these good things that have really made a larger impact, what are the key challenges and maybe opportunities as well you are seeing in establishing healthcare accreditation systems in diverse healthcare settings that we have across?
Yeah, thanks, Gaurav, for this very interesting question. And I think I have the fortunate of being into the system for long and in different capacity, in different roles, and not only in India, but globally. In my own home in India here, I've been part of NABL and then NABH when it was started in 2005-6 to join as a first staff. And that's really gives something, that as a first staff is some challenges which you have to have, but also you get opportunity to learn a lot and contribute. And then in last 7 years at QA, I set it up to start a new accreditation body. So there are challenges, obviously, and it's not easy to establish an accreditation system, at least a new system, because it's not that easy, because it's a complex system. It's like a healthcare ecosystem, which is complex. Similarly, an accreditation system within an accreditation organization is a complex. It's not just about conducting an assessment or survey and makes a decision. It's about a lot of a thing which goes in the back of the mind of the people, go back into the offices of different people to set standards, which are the backbone of an accreditation system. So the robustness of or the standards for accreditation is actually key to the success of any accreditation program. But there is a caution here. The standards should be such which can be used by the users. Setting a standard which people might think is of very high nature or a very high level, but the challenge will be that the organization may not be able to use and implement those standards. So if you can't use those standards, it will not serve any purpose. So we follow a basic principle of developing standards. We call it Rumba, which means the standard should be reasonable, understandable, measurable, beneficial, and achievable. If a standard passed on these five verticals, then it can be used definitely. So when we develop standards at QAI in last 6, 7 years, we develop over 18 standards following this principle of Rumba. So you get a client to use these standards. So we advocate that please use standards. Don't talk about accreditation, but use standards. You start implementing standards, start getting things to know how it makes difference in your organization. And then maybe later, if you think that, yes, you need accreditation, you can get accreditation. So I think that's how it should be. But unfortunately, it's not the case always. It's the other way around. People want accreditation first. They want a piece of certificate first, and sometimes they are in hurry as well. Going back that last 20 years, most of the bigger and matured organizations have already been accredited. So the challenges now are more because the smaller hospitals, the newer hospitals, and the hospitals or healthcare facilities in different towns and areas, tier 2, tier 3 cities, not in just metro, there are challenges for them to implement because of resources, whether it's a human resource or your infrastructure resource. So I think that is one thing which we need to keep in mind, that while it is good to go for accreditation, but we need to make sure that they are implementable. So when you look at that how we can make a balance of something which gives the benefit to the user of the standards and their users, which are the patients in a healthcare facility. So that's how it gives. So it's a really complex system to develop in healthcare ecosystem, and I have been fortunate to be part of developing accreditation system in different part of the world as well. For example, Nigeria, even Oman, and Indonesia, and some other part of the world. So and they have different challenges. There are cultural challenges, regional challenges, but I think things are moving forward. I can say that, and this will continue to grow and evolve over a period of time. Thank you.
So interesting. I think one of the things that I learned from you today is about Roomba. So very, very interesting concept, which I personally didn't know earlier. But thank you for sharing that. Actually, what you said leads me to another question that I wanted to ask you, was about misconceptions that healthcare organizations have about accreditations. And in the future, how can we shift their approach to see accreditation as an enabler rather than something they just need to do it for a certificate or for a regulation or to get more money from any of the regulatory bodies? How do we change that mindset? So what do you think we can do about it?
Yeah, thank you, Gaurav, for bringing this up. I think this is a great challenge before us as an accreditation organization, and even before the organizations who are into the part of the accreditation system. Yes, people. That's why I said, unfortunately, many healthcare organizations thinks accreditation is a magic band. You get it and you said everything right. It's not that. It's a tool. It's a tool to help and support the healthcare organizations and leaders to do things right. It's not everything. It's not just that you get it and you forget everything else. No, it's not like that. So first thing is need to be, and I'm sorry, but 20 years has gone, but still that is the perception, that is the perception. So I think the mindset need to change amongst us all, that accreditation is a tool for improvement. It helps us, but we have to go along. We have to take it forward with us. It's not just you just get it and set things right. So the first thing is to change the mindset. And as you said very rightly, it should be considered as an enabler of quality improvement, enabler for patient safety, enabler for staff safety, enabler of your business development. Who says that quality doesn't help in business? Yes, definitely. So for any organization, whether it's a healthcare or non-healthcare, business is the primary thing. You have to earn money to sustain, and so accreditation helps. And I think there are certain studies done by individual organizations that it really help in making more money. Making more money does not necessarily that you get more money. Even if you save some money, you should get more money, right? So accreditation helps in reducing your risk, reducing your waste, increasing your efficiency, make it more effective. So if you reduce your risk, even say a big hospital, if you are certain your risk, your human resources, your incidental risk, your natural risk, inherent risks are there. And if you are not able to take care of those, it might lead to some of the dangerous situation, which can get a bad reputation. And once a bad reputation can create a lot of problems for the organization. So I think it's the key that we should take accreditation as an enabler rather than as a requirement for getting into insurance and getting more incentives. Yes, that's good thing that yes, if we get it, we'll get more incentives. That's good thing. But this should not just end there. I think we should just start from there. Okay, we got it, right? We got the incentive. Now, can we build on this to further improve and use this as a tool for giving me more empowerment, giving me more strength to run my own organization, help my people to earn more, learn more, share experiences. Now, for example, how many the hospitals? I'm not talking about the corporate group
Right.
hospitals amongst themselves. You do a lot of things, but how many hospitals really share best practices with different group of hospitals? Can't we create such type of environment where
Yeah.
people start, talking about it rather than hiding about it? So I think there is time now that we need to start thinking in the direction that how we can create benchmarks.
Right.
Uh, Still, if we talk about infection percentage or all this, still we talk about some other benchmark. We don't have our own benchmark. So I think that is the time we start looking at more on the outcome side than the structures and processes which have been in place for last several years. Though it will be continuing for many smaller hospitals, but for mature organizations having quality system in place for last several years, is now they should start looking at outcomes and then measuring outcomes and make use of those outcomes for betterment of the patient care and safety.
I completely agree with you, on everything that you said. So, I guess we have reached one milestone of creating that awareness and people moving towards it, people excited about it, people also understanding that, okay, there is a gap between our understanding and what happens. So let's attend conferences, let's learn, let's do this session, let's do more training. So yes, but I guess still there is a long way to reach to a point where, 24/7, 365 things just happen because it's kind of a process. It's built in your DNA that it is supposed to be happening like this. I think I personally feel it's going to take some more time, but we are on the right path, and I think that's largely what makes most of the difference. So thank you for sharing that. That brings me to another question, on if you could largely share your insights on the development of international accreditation standards and what's that their impact on healthcare delivery system. I think that will be really very helpful.
Thank you, Gaurav. Again, I think there is again a good question because there are a lot of concepts and misconceptions. When we talk about international accreditation, we talk about international standards. So, if you say international standard, they come from either from WHO or maybe some international organization or like international organization for standardization, ISO basically, which are international standards. Like we have ISO 15189 for medical laboratories. It is used globally by medical lab and also accreditation bodies for accreditation. Unlike this, there was no standards in healthcare quality management system. And recently, a year back, when ISO published ISO 7101, this is the first ISO standard for healthcare quality management system, which is published. But there was nothing before. So most of the accreditation bodies were developing their own set of standards, and that has been the case. And then going to ISCA for the recognition of standards as an organization and training program, so on and so forth. So when an accreditation organization develop a set of standard, they may adopt different approaches. They just many ABs just want to have standards just to localize within their region or within their country. Some organizations would like to extend the boundary of accreditation to neighboring countries or even going global. So depending on the intent, what an AB has in mind to run an accreditation program, they start thinking on the developing standards. So it's about this expertise bringing in to develop the standards. So if you want to develop standards which you think is global, maybe more insight from the global perspective, from different stakeholders, from a global arena would be really helpful to put into the standards. But primarily, I think if you develop standards which are made for your own country and which is already like for example in India we are already gone ahead with in comparison to many other countries in not only in healthcare service delivery but in quality and safety as well. We can be comparing anywhere in the world. So I think if we develop standards, they are likely are the global standards. Maybe some practices here and there, but again, the healthcare standards are not prescriptive in nature, and which means that they are flexible and to be interpreted in a different manner, taking into consideration of the local and global scenarios. So those things can be extend it to that. So, but again, running an international program is not that easy because you have to have buy-in from different
Yeah,
international
yeah,
organization, and international organization globally from outside country definitely would like to see the credibility of organization. And I think so far accreditation bodies have been able to establish their credibility through ISCOA accreditation as an organization, and that has become a benchmark. And like we say, yes, if you are a ISCOA accredited organization, you would be functioning or operating your programs similar to other organizations. There may be a different level as in a hospital also. You may have different level of maturity, but the base remain at least all follow the basics which are set in the standard. So I think the momentum of going forward with the international accreditation is more like a thinking process. Oh, I want to have an international accreditation, but what that international accreditation means may not be even clear to many people organization looking forward. So I think I would only say that the people think should apply their wisdom and why they need, if at all they are thinking for international accreditation, what does it mean for them, what does it help, or how it help you in your own organization's perspective. All these things I think they need to do look at it. But again, like we operate internationally, maybe not many countries, but now we are operating around 11 countries for one or other programs, mostly our laboratory programs. And there are buy-in because we have set up international equivalents for our laboratory program also
right.
through International Laboratory Accreditation Corporation, we call ILAC. So I think that mechanism which exists globally, we call it mutual recognition arrangements. You mutually recognize.
Right,
So
right.
if there is an AB here in India, say QAI, and there is a body in A2LA in US or IS in US, both are part of ILAC MRA. So they are globally recognized, mutually recognized, and understand each other. Same thing for ISCO accredited organization in ISCO Healthcare World. So I think, but Gaurav, just one thing is I think there are a
Yeah,
lot need to do. And there are challenges, there are opportunities. Every day there are a lot of opportunities coming forward because earlier when we started thinking of quality and accreditation, it was like that's hospital.
yeah.
Now it's maybe single doctor clinic to hospitals and out of hospital care we call transition care,
Home
and
care and
a
home
home
care.
care we developed in 2017 when COVID before
Yeah,
COVID, and people say what is home care, but now people understand home care.
true.
And then similar to specialized stroke program, dialysis program. We developed hair transplant clinic standard recently, and maybe tomorrow morning you will see in social media we are launching a standard for bone marrow transplant. We call it cellular
Oh,
therapy.
wow.
It is one of the second. I think we will be the second in the world after JC Fact. Yeah, so I think these are the opportunities which we get requests from our stakeholders, and I think that is the beauty of accreditation. It's by nature it's a voluntary process. It's not a mandatory process, and that's why it brings empowerment to people that you choose to go for accreditation. Nobody is forcing you. If you don't want financial incentive from insurance, nobody can force you to go for accreditation. You choose. So if you choose, why don't you use it optimally for your own benefits, for the benefits of patient? So I think this is something which we need to really keep thinking, evolving in time to come. Thank you.
Thank you so much for sharing those key pieces of information. I think they were very, very helpful. And by the way, on record, you have announced what you were supposed to be doing tomorrow, the launch of bone marrow transplant standard. So thank you for sharing that on this platform. And I'm sure it's going to be really interesting and more interesting to work, comply, and make sure that, again, in that space, overall, patient care and outcomes have improved. So thank you so much for that. And this brings me to the last question for you for today. What excites you more about or most about International Patient Safety Conference 2025? You have been a part of it, I think, almost for all the last 11 conferences. And we always look forward to seeing you and meeting you and listening to you. So, what excites you the most, and how do you see this influencing the future of healthcare quality and patient safety?
Thank you, Gaurav. Very important. I think you are right. I have been part of International Patient Safety Conference by Apollo for last since it started off, and I have seen is how it has grown in size, in number, in content. Basically, the content. There may be numbers, but the content is the most important thing, which actually bring people together. As you see, there are a lot of conferences every day going on. Very difficult for people to select where to go. So I think that's one thing which IPSC brings in, that is a rich in content, which people would like to go and attend and see what's going on, not only India, but globally, because IPSC brings a lot of people nationally and globally also. That's number one. Number two, specifically for IPSC 2025, which you with the theme of era of patient safety. I think that's very apt. And we have been talking about patient safety specifically for the last few years, even after the launch of WHO Patient Safety Action Plan 2020-2030, a decade of patient safety, which has ignited several minds globally to start thinking, working, and doing something on that. So I think IPSC 2025 gives a lot of opportunity for healthcare professionals, which comes representing several healthcare organizations from India and globally to see what's going on. There are developments every year. There are certain developments going on to share the best practices, even learn and share. I think conferences, to my mind, is an opportunity for learn and share. What I know, I can share with my colleagues, and I can learn many things which many people share on in the conference. So I think I look forward to IPSC 2025 in just few days. And I really wish the conference a great success and wish that people should choose to come, that they get the content out of this conference. And then they go back to their own organization and use that knowledge and wisdom they gain for improving their own professional career as well as the organizational standpoint of view. So I think, Gaurav, thank you so much for having me again coming to IPSC 2025, and I wish this conference a great success. Thank you.
Thank you so much, Dr. Rana, for your time. Really, really very well appreciated. And, I think just by talking to you, I got so much charged up, though it's evening here, and I got so charged up listening to a lot of key points from you. But we really look forward to having you, listening to you at the conference, and then moving into the new era of patient safety. So thanks once again. A very good evening and see you soon.
Thank you so much, Gaurav, for having me here, and good evening to you. And we look forward to how we can contribute to patient safety. Thank you very much.
Thank you. Bye.
Bye-bye.